Washington state legalized medical cannabis in 1998. Recreational stores are not required to be endorsed for medical sales. An endorsed store must have medical cannabis consultants on staff, have DOH-approved product available for sale, and must be able to enter qualified patients in the medical cannabis registry. 420-friendly has been endorsed since 2016. There are 12 qualifying conditions that have been identified by the state of Washington where patients may benefit from the medical use of cannabis products. A spasticity disorder refers to conditions causing spasticity, which is an abnormal muscle stiffness, tightness, and an exaggerated reflex response to stretch. This stiffness interferes with smooth, coordinated movement and can affect daily activities, walking, speech, and more. It stems from damage or disruption to the nerves, brain, or spinal cord that control muscle movement and tone. Common conditions associated with spasticity include cerebral palsy, multiple sclerosis, stroke, traumatic brain injury, amyotrophic lateral sclerosis, ALS. Hereditary Spastic Paraplegia, HSP. Spasticity disorders are a qualifying condition for obtaining a medical cannabis authorization in Washington state. This allows patients to legally possess and purchase cannabis for medical use, including for managing symptoms related to spasticity disorders and their treatment. The Washington DOH oversees a voluntary medical cannabis registry. Patients can get a medical cannabis card from a medically endorsed retail store after receiving a qualifying authorization from a healthcare provider. Registration offers benefits such as excise and sales tax exemption on medical compliant products. A link to our video on how the database works and what you need to know about the benefits of having an authorization will be featured at the end of this video, or you can find it under the playlist Medical Cannabis. The program allows a qualifying patient to name a designated provider to purchase and/or grow cannabis on their behalf. Designated providers must also be registered and hold a recognition card. Cannabis can help with spasticity, particularly for conditions like multiple sclerosis, MS, and spinal cord injuries, with some research showing it can provide significant relief. The primary components, THC and CBD, work with the endocannabinoid system to improve communication between nerves and muscles, reducing the frequency and intensity of involuntary muscle contractions as they interact with CB1 and CB2 receptors, which are involved in regulating muscle control. Modulating neurotransmitters. By binding to these receptors, cannabinoids can modulate the effects of inhibitory and excitatory neurotransmitters, leading to a reduction in spasticity. Reducing muscle contractions. By improving nerve-to-muscle communication and potentially blocking inflammatory actions, cannabis can help alleviate the uncontrollable muscle contractions associated with spasticity. It is crucial for patients to have an open, non-judgmental conversation with their care team about cannabis use. This ensures they are aware of potential drug interactions and safety concerns. Because state and federal laws on cannabis differ, it is important to understand the regulations in your location. Multiple terpenes, especially those found in cannabis, have shown potential for reducing spasticity due to their anti-inflammatory, muscle relaxing, and sedative properties. The specific effects depend on the terpene, and some may work better for daytime versus nighttime use. Research on terpenes is still emerging and often overlaps with broader studies on medicinal cannabis. Limonene. This citrus-scented terpene has shown anti-inflammatory and pain-relieving effects, and may also improve mood. Some evidence indicates it can improve spasms in smooth muscle. Examples of strains high in limonene include Kush, Jack Herer, Super Lemon Haze, Cinex, and Wedding Cake. Beta-caryophyllene. This terpene has strong anti-inflammatory and analgesic, pain-relieving, properties, which can help reduce inflammation and muscle spasms associated with spasticity. Examples of strains high in beta-caryophyllene include Bubba Kush, Sour Diesel, Gelato, Chemdog, Death Star, and GG4. Linalool. With a floral aroma, linalool offers sedative and anti-inflammatory effects that may assist in reducing muscle spasms and inflammation. It has also demonstrated neuroprotective qualities in laboratory studies. Examples of strains high in linalool include Do-Si-Dos, lavender, Skittles, Grand-Daddy Purple, and Amnesia Haze. Myrcene. The most common terpene in cannabis, myrcene is known for its sedative and muscle-relaxing effects, which can help reduce tension and induce sleep. Examples of strains high in myrcene include Blue Dream, Grand-Daddy Purple, Grape Ape, White Widow, and Tangy. Alpha-pinene. Research points to the neuroprotective and anti-inflammatory properties of alpha-pinene, which may offer therapeutic benefits in neurodegenerative diseases that cause spasticity. Examples of strains high in pinene include Dutch Treat, Blue Dream, Jack Herer, Harlequin, and Lemon Sour Diesel. Humulene. Studies show that this terpene has anti-inflammatory and pain-relieving properties. Examples of strains high in humulene are Death Star, Sour Diesel, Dog Walker OG, GG4, and Headband. Research suggests that terpenes can work synergistically with cannabinoids, like THC and CBD, and other compounds in a phenomenon known as the entourage effect. For spasticity, certain combinations may be more effective than isolated compounds. A blend of myrcene, pinene, and limonene may help ease muscle contractions. Combining caryophyllene and humulene may be effective for muscle spasms. Cannabis strains with a balanced ratio of CBD to THC have shown promise for treating spasticity, with the terpenes potentially enhancing the anti-spasticity effects of the cannabinoids. The two most studied active compounds in cannabis are tetrahydrocannabinol, THC, the psychoactive compound that can help with muscle control, pain relief, and nausea. Cannabidiol, CBD, a non-psychoactive compound known for its anti-inflammatory and analgesic, pain-relieving, properties. More research, including human trials, is needed to fully understand the endocannabinoid system, phytocannabinoids, terpenes and flavonoids, their effects, benefits, and optimal usage. How they all work together and in what combinations. While progress is being made, it is important to always consult your doctor before using cannabis to treat any medical conditions, as it may interact with other drugs, particularly those affecting the central nervous system or metabolized by the liver. It is known that certain cannabinoids may enhance the effects of blood thinners and sedatives, and it could potentially alter the effectiveness of antidepressants and immune modulators. Thank you for joining us. We hope this information has been helpful and that you'll join us as we continue to explore the potential benefits of this amazing plant. Please hit that like and subscribe button and leave us a comment and let us know if there are any other topics you'd like us to cover. Until next time. Peace.